I'm Susan Hoagland. I'm Executive Vice President of the California Academy of Family Physicians. The political and PR noise about healthcare reform, starting with whether you call it the Affordable Care Act or Obamacare, makes it difficult to figure out just what the law actually provides. Our thanks to Bill Sokol and the San Francisco Chronicle for this simple list of what every person in California needs to know about the law and his or her rights under the law. And people are especially looking to their physicians and physician assistants, as well as members of medical office staffs, for answers. So here's the bottom line. Every citizen and legal resident must have health insurance in 2014 or pay a penalty. So if patients' employers already provide minimum value affordable health insurance for them, they don't have to worry about all of this. They're covered. And minimum value means the insurance pays at least 60% of the cost of benefits. And affordable means that it costs no more than 9.5% of annual income for such coverage. So if an employer doesn't provide this coverage, or if a patient is unemployed, just employed occasionally or part-time, and expects to earn less than $15,856 in 2014, that individual is entitled to free Medi-Cal. And that patient can sign up with Medi-Cal by applying at the Covered California website, www.coveredca.com, or calling 800-300-1506. So California is working to ensure that there is what's called no wrong door, that wherever an individual goes to get information, he or she is going to be referred to the correct source, whether it's private insurance or Medi-Cal. If an individual earns less than the amounts you see here, he or she may be entitled to tax credits and subsidies to help pay for health insurance. Patients can sign up, again, for subsidized health insurance at www.coveredcalifornia.com. That is to say, rather, coveredca.com, And they can also call 800-300-1506 for assistance. Or patients can purchase new legal policies from their insurance agent, broker, company of their choice. Cancellation letters only affected people who had purchased insurance that didn't meet the standards of minimum value insurance with no annual limits, no lifetime limits, etc. I heard a story on NPR on the way to work the other day about a dentist in Nebraska, a young woman, who was covered and had a policy that she paid $46 a month for. But because of all the discussion about healthcare reform and problem policies, she finally read the fine print, and she learned that she would only be covered for emergency room care if she were in an accident, not if she became very ill and had to be admitted to an emergency room. So I think that's the kind of concern that is being addressed now. So the bottom line is, if your patients or their family members have any questions about to what they're entitled, please encourage them to call 800-300-1506 or go to www.coveredca.com. We also just heard from Covered California that they have some additional new services that they can provide, availability of a new service to help people with questions about potential premium increases, plan options, network changes, or other issues related to their transition from current market non-grandfathered insurance policies to coverage under the Affordable Care Act. A new hotline number is 855-857-0445. And CAFP is here to help. Here are the services we can provide you and your office staff members. And I want to thank you for listening.